We spoke with a UMass economics professor as well as the owner of a small medical practice to learn how the U.S. health insurance system affects businesses.
The United States is the only advanced country that doesn't in some way centralize healthcare coverage in a way that takes the burdens off of the companies that employ people, and because it's centralized, offers a lot more cost containment. This decentralized system is a recipe for out-of-control costs, and that's exactly what we're experiencing. The companies are the source of most health insurance, and it probably isn't the best source. It makes the system very decentralized and fractured and inconsistent. It now is costing companies way too much. They've become less competitive globally because they pay these health insurance costs where other countries that cost is centralized. Those costs are still reflected in their tax system, but cost containment is far more successful when you centralize the effort. So the whole business of offering health insurance for your employee, through your employer rather, is unique to this country and arose out of a unique set of circumstances, and it was not planned, and therefore was not well planned.
From a national level to a state level, like Massachusetts is kind of quite different than a lot of other states, in the union, in that it's kind of mandatory for people to have health care here. So, but it's hard for me to say like how the patients feel about it, because they usually don't talk about that too much to us, But I think for us, like from our standpoint as also healthcare professionals, it's very frustrating, like with the insurance issue, because it doesn't make sense to us that there should be some middle person between me and my patient that's making money off of this exchange. Like there are a lot of acupuncturists that are really like geared up on trying to get acupuncture covered by insurance, but I think it's a mistake. Like chiropractors went through the same thing, where they lobbied really hard to get covered by insurance, and now that they are covered, they're making less money themselves in their businesses than they were when they weren't accepted by insurance, because they have to have 2 or 3 people on staff full time to try to get money payment from the insurance company. Mm-hmm.
The issue is that there is now such a bureaucracy around insurance. If it were just the provision of services, of medical services to the customer carrying the insurance, I think there'd be no problem. I think most companies would accept an insurance carrier and provide the service. But the problem is once you do it, a couple of constraints arise. Number one is that the paperwork involved with it can be pretty daunting. So a company that accepts it has to have an entire back office operation that processes the paperwork, and it can be a pretty elaborate process. Some fairly small medical offices have maybe 2 people dedicated completely to doing this kind of paperwork. The other issue is that at times insurance mandates maximum payment for certain kinds of procedures, and these maximum payments can perhaps even be lower than the actual cost of provision.
There are some patients that use our invoices to get reimbursed from their insurance company, but because we do a sliding scale, insurance companies will not let us bill them directly. This is a rule that the insurance companies have. If there's a sliding scale, if every patient's not paying the same fee, we can't bill them directly. But this is a good thing for us, because if we had to take insurance, we wouldn't get paid on time, and we would have to hire staff to do the billing and insurance for us. So that's more overhead for our costs, which we would have to pass on to the patient.
I think what's happening is that as the country moves toward more cost containment, one of the issues that's going to kind of arise along with it is more and more medical offices are going to resist accepting insurance.
It's very difficult for like a chiropractor, any type of doctor, acupuncturist, herbalist, anyone, to totally just give the most appropriate care and be with the patient and do what's best for the patient when you have money hanging over you, because like we need to make a living too. That separation makes it very difficult even for biomedical doctors to really give the care they feel the patient needs at the time, because they're constrained by what the insurance companies tell them will be covered or not covered.
Mhm.
And I think that kind of makes runaway costs happen.
If they can contain costs in a way that redirects the whole system from maximizing procedures, because that's right now what drives up costs, but also what drives up the incomes of the medical professionals, because the more procedures they get somebody to have, the more money they get from the insurance companies. And sometimes these procedures don't even really help. So the more effective cost containment that moves the healthcare industry away from maximizing the number of procedures every patient gets to focusing on health outcomes, the more quality is going to be improved, more than just the quantity.
You know, as a community, town, city, state, and nation, we need to reevaluate what's the best way to deliver the most appropriate health care.
I think the only way it's going to change is sort of small piece by small piece. One thing that the current healthcare legislation does have in it is a number of experiments with trying to do healthcare, deliver it differently, insure it differently. And it'll be interesting to see over the next few years if any of these experiments turn out to be really successful and end up being models for how we can change the healthcare system in a way that really works a lot better. So I think that over time, once this legislation gets in place, there'll sort of be a mechanism for trying to change it piece by piece, and I think that's the way it's going to change. I don't think you're never going to see a revolutionary change. If it does change, it's going to be piece by piece, moving slowly in the right direction.